A Sphygmomanometer is a medical device used to measure blood pressures, typically consisting of several key components. So the first one is the bulb. The bulb is a rubber pump that inflated the cuff. The next one is the releasing knob. It is controlled the release of air from the cuff to gradually reduce the pressures. The next one is the cuff. The cuff would wrap around the upper arm to apply pressure to blood vessels. And lastly, the nanometers is a gauge that displays the pressure reading. Nextly, we will talk about a stethoscope. A stethoscope consists of several key components. So first, we're gonna talk about the earpiece. The earpiece is a soft tip that fits into the ear for clearer sound transmissions. Next is the tubing. The tubing is flexible, connecting the earpiece to the chest piece and transmitting the sound. And next one is the chest piece. It has two parts. The first one is diaphragm part, which is a flat surface that picks up frequency sound like heartbeats. And this is the bell, a smaller cup-shaped side that detects low-frequency sound like heart murmurs. So next one, we're gonna talk about how to open and close. The stethoscope can be opened and closed by locating the chest piece to switch between diaphragm and the bell. Next, we're going to talk about the two methods of measuring blood pressure with a sphygmomanometer. The first method involves using the brachial artery near the elbow, in which the auscultatory technique will be used with a stethoscope. The second method is using the radial artery at the wrist in the palpatory technique, where the pulse is felt with the fingers to estimate blood pressure. Now we're going to start measuring blood pressure by placing the cuff onto the patient. First, we will release the Velcro of the cuff, and then we will position this on the patient's arm with the tubes facing downwards. And then we will make sure that it's about 1 to 2 inches above the elbow and that the tubes align with the brachial artery. And then we'll wrap it around snugly, and then we will secure the Velcro. And the tip to check the fit is to ensure that there's enough space for 2 fingers to fit underneath the cuff. Next, we'll also make sure that the valve on the bulb is closed so that air can properly inflate the cuff when it's pumped. Now we're going to start measuring the blood pressure using the palpatory method. So first, we're going to find the pulse on the radial artery at the wrist, which is located just below the base of the thumb. Next, we'll start pumping air into the cuff to compress the brachial artery. As we inflate the cuff, the pulse felt at the wrist will eventually disappear. Now that the pulse has disappeared, we need to open the valve to release air from the cuff so it doesn't compress the artery too tightly. When the air is released, the pulse will reappear and corresponds to the systolic pressure. We will now fully release the valve to completely deflate the cuff and allow blood flow to return through the artery. The result is 110 millimeters of mercury for systolic pressure, but this method is less accurate since it doesn't measure diastolic pressure. Next, we are going to be measuring the blood pressure using the auscultatory method. This method requires the stethoscope because it allows for the detection of the Korotkov sounds, which are essential for accurately measuring blood pressure. To use the stethoscope, first we position the diaphragm directly beneath the cuff, below the tubes, and over the midpoint of the elbow. So this placement enables you to clearly hear the Korotkov sounds associated with the blood flow. Next, ensure that the earbuds of the stethoscope are facing outwards for proper alignment, and then insert them into your ears, making sure that they fit snugly for optimal sound transmission. Now we'll ensure that the valve is closed again to pump air into the cuff and occlude the brachial artery. As the pressure rises, you will begin to hear the Korotkov sounds, which are sounds produced by the turbulent flow of blood in the arteries as the pressure in the blood pressure cuff is released.
They are used to determine the systolic and diastolic blood pressure during auscultation. The first sound heard through the stethoscope indicates the systolic pressure. When this occurs, gradually release the valve to let air out of the cuff. As the pressure in the cuff decreases, the carotid cough sounds will gradually soften and become fainter. Eventually, they will disappear and signifies the diastolic pressure and marks the transition from turbulent blood flow to laminar blood flow. The result of this auscultatory method is 120 over 90 milliliters of mercury. This method is more accurate because it detects the carotid cough sounds through a stethoscope as the cuff pressure is gradually released and allowing precise identification of the systolic and diastolic pressures.